Did you know your skin, nails, and even your breath can hint at your kidney health? I deal with kidney disease every day. It's way more common than you'd think and often goes unnoticed. Seriously. About 90% of folks with long-term kidney problems don't even know they have it. That's a big deal because catching it early means we can often fix the problem and stop more damage. So today I'm going to show you 17 top signs of chronic kidney disease. This info could really save your kidneys and your life. Your kidneys, those two bean-shaped organs, sit on each side of your lower back right under your ribs. Most people see them as filters, which is true. They get rid of toxins in your pee. But they do so much more. They help control salt, potassium, and other stuff in your blood, balance its acid levels, control your red blood cells, and keep your bones healthy. So how do you know if these super important organs are in trouble? Let's start with foamy pee. I'm not talking about a few bubbles that disappear fast. I mean a thick layer of dense white foam that sticks around, like the head on a beer. This means a protein from your blood called albumin is leaking into your pee. To get why this happens, let's look closer at your kidneys. Each kidney has about 1 million tiny filters called glomeruli. Each one is a tiny bunch of blood vessels, so narrow red blood cells have to squish through one by one. If we look even closer, you'll see what look like tiny hairs on the blood vessel surface. These are tiny tentacles from special cells called podocytes, which act as a living filter. But if these podocytes flatten, gaps open in the filter, letting proteins like albumin leak out. This can easily go unnoticed. Luckily, albumin is kind of like soap, which is why it makes that thick foam. I even have a bottle of albumin we use in the hospital, and you can see how foamy it gets. Okay, let's try a quick test together. I do this with most of my patients in the hospital. Roll up your pant leg and press your thumb gently into your lower shin bone for about 5 seconds. Then see if it left a dent. If it did, that's called pitting edema. This happens because of the frothy pee. When you lose albumin through your pee, you end up with less albumin in your blood. Albumin helps keep fluid inside your blood vessels. Without enough of it, fluid leaks out into your tissues, causing swelling. This extra fluid tends to go down with gravity, which is why most people notice swelling in their legs and feet. It can also show up in loose tissue, like around your eyes. But here's the kicker. Even though you're swollen, you actually have less fluid flowing in your blood vessels. Your kidneys think you're dehydrated. So to try and help, they hold on to more salt and water, which just makes the swelling worse. It's a bad cycle. In serious cases, that fluid can even get into your lungs, making it hard to breathe. Before you freak out, lots of things can cause leg swelling. A little bit can even be normal after standing all day, but that should usually go away overnight when you're lying down. If your leg swelling doesn't get better or you see more swelling around your eyes, it could be your kidneys, and you should get it checked. All right, let's talk about a common misunderstanding. Most people think peeing a lot means healthy, working kidneys. But for your kidneys, quality matters more than how much you pee. In fact, one of the first things to go when your kidneys are struggling is their ability to make concentrated pee. This is most noticeable at night. Normally, your kidneys make concentrated pee overnight, partly because you're not eating or drinking, and partly because of a hormone called ADH. So if you're waking up multiple times to pee at night, we call that nocturia, it could be an early sign of kidney disease. Now take a look at your nails, especially their color. It's normal to see two colors, especially on your thumb. The lighter part at the base is called the lunula, which just means little moon. Think of it as nails still being built. Now compare that to these nails from a patient with chronic kidney disease. They also have two different colors, but don't be fooled. That's not a normal lunula. The other half of the nail is a reddish-brown color. These are called half-and-half nails. Not everyone with chronic kidney disease will have nails like this, and we don't actually know why it happens, but there's a clear link between these nails and kidney disease. Let's shift gears to phosphate, a mineral your body carefully controls. When levels get too high, it causes big problems. We get phosphate mainly from food. Most of us actually get too much. But healthy kidneys can handle it easily. When your kidneys are damaged, they can't get rid of that extra phosphate, so levels go up in your blood. This matters a lot because phosphate binds to calcium, forming calcium phosphate crystals. Depending on where they land in your body, they can cause all sorts of problems. When these crystals settle in the skin, it's called calcinosis cutis. It usually shows up as whitish yellow bumps that are hard under the skin and don't hurt. Sometimes they can break open, and what comes out looks like a thick paste of calcium phosphate, kind of like toothpaste. Besides kidney disease, you also see this in autoimmune conditions like scleroderma or dermatomyositis. So as a rheumatologist, I see this pretty often. While these can be tough for patients, in some ways it's a better outcome because those same calcium phosphate crystals can also settle inside blood vessels. That can lead to a medical emergency called calciphylaxis. In these cases, blood vessels get blocked, organs and tissues don't get enough oxygen, and in severe cases, it can be fatal. But there's another more subtle way high phosphate can mess with your blood vessels. Look at this x-ray. Yep, I know he's missing part of his finger. Ortho will handle that. What I want you to see are his arteries. You're not supposed to be able to see them that clearly on an x-ray. So what's going on? Your arteries normally have smooth muscle cells that can squeeze and relax to control blood flow and pressure. But when they're drenched in phosphate, these cells get confused. They start acting like bone cells, laying down calcium phosphate into the artery walls. So the artery wall, which is usually flexible, becomes hard as bone. You can actually feel it under the skin. The best way I can put it is it's like a guitar string under the skin. So clearly, high phosphate levels are a big problem. Part of how your body tries to deal with this is with a hormone called FGF23. This hormone tells your kidneys to get rid of phosphate in your pee. It also tells your gut not to soak up as much phosphate as well as calcium. It does this by stopping vitamin D from becoming active. Eventually, calcium levels start to drop, and that can lead to awful muscle cramps, especially at night when you're trying to sleep. While low calcium is one cause, early kidney disease can also cause low magnesium or too much acid in the blood, all of which can lead to muscle cramps. So if you have unexplained muscle cramps and you haven't just started a new workout routine, it's worth getting your kidney function and electrolyte levels checked. Okay, let's talk about calcium again. When calcium levels are low, your body releases parathyroid hormone. This hormone tells your cells to start breaking down your bones to put calcium into your blood. It's a good quick fix, but over time you can imagine you're just fixing one problem by making another. This leads to weak, brittle bones that break easily, which we call osteoporosis. A key sign of osteoporosis I look for is losing height. So it's a real warning sign when a patient tells me they're a few inches shorter than they used to be. Of course, breaking a bone after a small fall, especially in the wrist, spine, or hips, is a clear sign. Beyond electrolytes, a bunch of toxins build up in your blood when your kidneys are struggling. We call this uremia, which is a fancier way of saying pee in the blood. The earliest signs can really mess with your sleep. A constant full-body itch, usually worse at night, can sometimes be the first sign of kidney disease. That's exactly what happened to this 57-year-old man. He went to the doctor after scratching his skin raw, and blood tests showed he had advanced kidney disease. A few things can cause this. Uremic toxins can build up in the skin and irritate it. These toxins can also turn on an itch receptor called PAR2, making your nerve endings super sensitive. Even worse, they can eventually get into your brain and constantly activate your itch centers, leaving you always itching. Now, restless leg syndrome is a super annoying condition that makes you feel an overwhelming urge to move your legs. Symptoms are usually worse when you're lying still at night trying to sleep. The main idea is that when your brain has low iron, it can't make enough dopamine, which triggers this huge urge to move. But what does this have to do with your kidneys? Well, uremic toxins cause inflammation, and this leads to producing hepcidin. Hepcidin is a hormone meant to protect your body from bacteria, which love to eat iron. Here's how it works. During an infection, hepcidin stores your body's iron and prevents more iron from being absorbed from your food. This helps starve the bacteria while your immune system kills them directly. But here's the problem. As your kidney function gets worse and toxins build up, hepcidin levels go up wrongly. So even when you don't have an infection, your body is constantly starved of iron, and that's what leads to restless leg syndrome. So if you're having trouble sleeping for any reason, it's a good idea to check your kidney function.